So, I want to discuss some of the nuances in terms of treating fractures. Many times, of course, you realize that many fractures or broken bones that we can treat in a cast. Many of the things that I do, of course, involve surgery, and that involves different equipment, plates and screws. And of course, the different fancy bells and whistles that we have, different things, and the technology has really expanded. But one of the most important aspects of treating these injuries and making sure that things go well is really the quality of the bone, and that's not entirely in the control of the surgeon. Now, many of you realize that there can be conditions such as osteoporosis or thinning of the bones as you get older. But I've noticed that even in younger patients nowadays, for nutritional reasons, they just don't have the best bone quality. Now, sometimes I can really tell, and it's obvious when I'm operating on patients, that they really have great quality of bone. And even when drilling into bone, you can actually wear out the drill bit if you really have good quality. On the other extreme, you can have bone that's really like more like soft cushion or cheese. It's like really just moldable and malleable. And so obviously, if you think about repairing something, say if you had a 4x4 and you were screwing it together to another 4x4 piece of wood. If you had a nice healthy piece of wood, it's treated properly, it's solid, you can get a good bite with that screw. If you can imagine a piece of wood that was maybe splintered or maybe soft or maybe it was even rotten, and then try to put that same screw into that piece of wood, and even though that screw might get some bite, it's going to be weaker in its fixation. And so the same thing applies to when fixing these fractures. And so that's one of the most important parts of actually getting things together is that if I have great bone quality, I have lots of tools to be able to put things together. When the bone quality is poor, there are actually fewer options because the bone is not going to support the amount of hardware needed in many cases to stabilize things. So this is another factor when I'm discussing with patients, the types of things that I use. Patients want to know, are you using a pin, are you using a screw, are you using a plate? And many times these things are interchangeable in terms of language, but we really specifically use these different things and even external devices to fix fractures. And all of them depend on your bone quality. So it's one of those things, many patients are deficient in certain nutrients, particularly vitamin D and calcium. I've noticed that a lot of people are not milk drinkers, and they're also, in terms of the calcium, green leafy vegetables, or even supplements. This is a very common thing that I find that patients have weaker bone. And I'm noticing that more and more. And it's not just with older patients as you would expect. So it's something that I would say to consider, whether it be before or after an injury, making sure that you have the appropriate nutrition, supplementation, vitamin D and calcium to make sure that your bones are strong. And if you are older, getting tested with DEXA scanning and things of that nature to make sure that if your bones are getting weaker, that you do things to mitigate that. So that's just something that I was thinking about as patients often ask me, how I'm going to fix something. And one of the real dependent factors of how I'm going to fix it is what is the quality of the bone.